Hello, everyone. We have all heard that saying that says, you are what you eat, and that cannot be further from the truth. Really, the state of your body or the health of your body is going to be highly determined by what we eat. But then what we fail to realize, or we don't really make the connection that what we eat actually starts or it comes in through the mouth, right? And so that's what is really important, is to understand that the oral health is very, very important, because by the same way that your food gets in from your mouth to the rest of your body to go and nourish your body, it is the same way that your mouth is connected to the rest of your body. And when we say that, it's like, well, duh, who didn't know that? But many times, we don't view oral health with its interconnection with the rest of the body. We kind of separate it, and maybe that has been facilitated, especially here in the US, by the fact that we have different insurance. For example, you have the insurance for your doctor, insurance for your eyes, insurance for your mouth, as insurance maybe like for other things. And that's probably because we fail to realize that it is one body, one system, right? And everything is interconnected. Your eyes are not separate. When you look at yourself, you're like, well, yeah, of course, that's obvious. But yes, oral health, it does, if you don't take care of it, will affect the rest of your body. And when you go to a dentist, there are many diseases that can actually be detected in your mouth. Diabetes, for example, can be detected when you have an oral exam, right? Because there's maybe that fetid smell that we can smell and say, if the person didn't know that they had diabetes, we may be able to detect it. There's other diseases, many other diseases that can be detected in the mouth, and also many diseases in the mouth, of the mouth. So I wanted to kind of sound an alarm as far as oral health being highly, highly important for the rest of your body. We'll take a disease like maybe like periodontitis. Periodontitis affects so many other systems, other diseases can be connected to it. And what is even periodontitis? Many people may not know what it is and are maybe more familiar to the term gum disease. And so gum disease is pretty much any diseases that has to do with your gum and everything that's hidden under your gum. Like under the gum, you have a bone that actually sustain or support, your teeth, your gum itself, and everything else. So periodontitis is when your gum disease has not just been localized to your gum, but actually has actually trickled out all the way to the bone that supports your teeth. So when you have periodontitis, you have a decreased level of bone, the bone that supports your teeth, and maybe you can end up having infection at your gum level, sometimes pus. And yes, that sounds yucky, nasty. It happens sometimes. You do an exam and you do see that the patient, when you kind of like palpate or when you press on some areas of the gum, there may be some pus coming out. But many times that's not often. Many times though, you would have like teeth that are mobile, right? And so how does periodontitis affect the rest of your body? There is a correlation between periodontitis and many other diseases. For example, somebody that has periodontitis will be prone to also diabetes, for example, and it goes as such. You have periodontitis, it affects your diabetes, or you have diabetes, and it can also lead to problems at the level of your gum. You also have things like having periodontitis, so you have infection, at that level. You may understand that the blood circulates from all parts of the body and goes to your heart. Your heart will pump it out to the rest of your body, and it goes on and on. The cycle repeats itself. So if you have an infection in your teeth or in your gum, rest assured that that infection will travel through your bloodstream all the way to your heart, all the way to your brain, and come back to the rest of your body. So an infection in your mouth can end up causing problems in your heart. And it doesn't happen all the time or often, but there are some people that can end up having a heart attack, can end up having a stroke because of infection in their mouth. And I have often told you people or other people, my patients or friends, that I had an uncle who actually passed because he had an infection in his mouth. He had a tooth infected, and that was in Congo. And he ended up going to the dentist, but it was late because that very day he passed. And I remember talking to one of my dentist friends, and she stated, and she said, dentistry is not life-threatening. But this is true in general. But there are cases like my uncle where his life got threatened and he lost his life. These are not things that we think often or that we realize, or it's not in the forefront of our brains. But unfortunately, it does happen, and it happened in our families. And while I was telling someone this story, I remember a couple weeks ago somebody else telling me, yes, she had heard that happening in her friend's family. So these are stories that don't happen often, but lo and behold, I would hate for you, for your family member, for your friend, to be that person that would be affected in that way, right? I would hate for that to happen to you. There's another thing that can happen is that we heard studies that shows a correlation between periodontitis and low birth rate. For you, mom, you pregnant, maybe you had been trying for a while, and finally you have that baby in the belly growing, and you're happy and everything like that. And then guess what? You don't take care of your mouth. You don't take care of your teeth. You don't value or else you don't go, get your routine checkup. You can end up having a low birth rate baby. So instead of your baby being born with the full weight, now they have a low weight. That can be affecting your baby, the one that you have nurtured in your belly. You rubbed your belly, every once in a while, or you felt those kicks. And now the baby has been affected because you did not take care of your oral health. You wouldn't want to be that mother. You wouldn't want to do that to your child, right? You wouldn't. And then we found out too, there's a correlation between periodontal disease and Alzheimer's disease. So yes, you don't take care of your teeth, you can end up having some cognitive difficulties where you can't remember things because your brain has been affected. And you wouldn't wish that on your parent, or you would not wish that on your future self, right? I mean, I can go on and on and on and on and on and on. And you can do your research as well. You definitely don't want to neglect oral health because it can affect your overall health, the rest of your body. So what should you do? And it's simple, It's simple. Oral health is not rocket science. Go ahead and brush your teeth twice a day for about 2 minutes, morning and night. Go ahead and floss between your teeth so you remove all the debris that the bristles of your toothbrush cannot reach because the spaces between your teeth are yay small, So you use your floss accordingly. You can use mouthwash, but definitely go and get checked by your dentist that you trust at least twice every year. Some people may say, I don't have time, but can you afford? Because when life happens, it happens, right? If you have pain now in your tooth, or if you have an infection, guess what? You will find that time. So why not prevent versus treating? But if you do come to the point where you have to treat, then yeah, go and get treated. But it's good to prevent things versus now chasing, for a solution. That's my advice for you today. I wanted to kind of paint a picture of the importance of oral health, and also kind of sharing with you how it is easy to actually take care of your teeth. And when I say it's easy, yes, especially in the US, it's very expensive. And that's why maybe you can try to get insurance or maybe go to a school where things are cheaper, or maybe find like a nonprofit organization, that is able to help people with their oral health. May do something. By all means, try to do something. So I'm Dr. Valerie Mukanga. I am the founder and owner of Healing Wings Dental. I call it a place where we help our patients maintain and regain their oral health and their smile so they can soar in life. And if you are in our area, we are located in Arlington, Texas, in the big DFW area, which is Dallas, stands for Dallas Fort Worth area. We are willing to help you. We can help you. You can call us 972-213-0202, or you can go to our website, www.healingwingsdental.com. You can also come to our facilities. Our address is 4101 West Green Oaks Boulevard, suite number 317, and our zip code is 76016. And we will be happy to take care of you and become part of your journey as far as your oral health is concerned. That being said, I wish you a fantastic rest of the week. Be absolutely blessed to the uttermost, and we'll see you next time. Bye-bye.